Hi, my name's Dan Oppenheimer. I'm a remote radiologist at the University of Rochester Medical Center, and I co-authored the point piece for this remote radiology, which was point enhancing efficiency, promote work-life balance, and ameliorate staffing issues.
It's good to meet you and actually talk in virtual person rather than just communicate via email. So nice to meet you.
Yeah.
And I'm Marla Sammer. I'm a pediatric radiologist at Texas Children's Hospital, and I'm one of the co-authors on the Counterpoint to remote radiology. And our case is basically, a case for presence and being in person. So we're looking forward to kind of discussing that and seeing what, the pros and cons of both.
Sure. Yeah, so I guess I'll just sort of start with the first piece that we went for, which was efficiency gain. So as a remote radiologist, usually you're working from your home workstation or some isolated location. And certainly, by being separate from a lot of the distractions and interruptions that are common in a busy reading room, you can be more efficient in that way. Also, you can kind of develop your home workstation in a way ergonomically that is best suited for you. So you can use a mobile desk, a motorized desk that can go up and down, for example, or a comfortable chair, or just develop a space that's most conducive to you working efficiently. And then the third piece for efficiency that we talked about was saving time in terms of commute. So not needing to have to deal with not just the time of a commute, but also the stress that can potentially be introduced with weather or traffic or parking or other kind of unforeseen circumstances. And so we believe that these efficiency gains can translate into either being a more productive radiologist in terms of clinical volume, or having more time to do non-clinical work, or other endeavors outside of work, potentially.
Yeah, I mean, and I would say that my co-author and I, we totally agree with you, but also, have some points about why it's important also to be in person. I would say before we get into that, I wanted to say that both my co-author and I, so Dr. Andrews is my co-author, we both sometimes work remotely, and we both very much enjoy being able to work from home, and have found it substantially beneficial to our life to be able to sometimes work remotely. But mainly in our counterpoint was just the need for presence, and what does that mean as far as long-term fulfillment, in a person's just overall life. So we divided it into three sections, but before really, and tried to make points in those three sections, which were professional, educational, and social. But before, going into each of those sections and why we think it's important to be present, we mainly also made the argument that it's really not, the long-term effects of working entirely remote and, not really being fully present in the workplace. Those long-term effects really aren't known. And so maybe, this is kind of yes, people have been working remotely, but precipitated by the COVID pandemic, it really has shifted quite a bit. And for our society, we don't really know what the implications of having, workers that are entirely remote will be, years from now. So that was one of our big arguments, is that really we just don't know yet. Do you have thoughts about that, Dan?
Yeah, I mean, so I'm a fully remote radiologist. I've been fully remote for 3 years now, and before that, I was kind of partially remote. I feel like certainly there's some potential to be a little more disconnected from your colleagues, and have some other struggles, not just sort of missing your colleagues or not having that connection, but also maybe feeling more isolated in terms of getting support if you're more junior in your career. But I think that the big benefits, though, kind of outweigh some of those struggles. So I think work-life balance can really be promoted with a remote and with flexible work arrangements. And I think radiology is really perfectly suited for these kind of flexible shifts, flexible work schedules, and flexible work locations. And so when you have these flexible options available for employees, they have greater satisfaction and potentially greater productivity when they have control of their work environment. And so, we have implemented remote radiologists in our department, and one of the ways that we've tried to use them is to have people supplementing coverage in busy times of the workday, shift changes, off hours coverage, weekends, also to cover for unexpected absences. And so it really has, I think, improved the work-life balance, and not just for the pure remote radiologists that we have, but it really has also been something, as you alluded to before, some of our on-site radiologists are also taking advantage of remote options available to them from home to make their work life easier, or to deal with childcare or other family issues. Having a remote workstation is a beneficial thing, even if you're a traditional in-house radiologist.
Yeah, I mean, I think that there's no doubt that having the options to work remote, that it does for sure improve efficiencies, and that the flexibility that really is important to radiology in general and for departments. As far as some of the arguments we made, which maybe can be definitely is better addressed, but just as far as differences, as far as inequities, and making sure that fairness is also promoted. So some things that are very important to burnout, like you said, flexibility. That's lack of flexibility contributes to burnout. Lack of fairness also contributes to burnout. So it's not a reason, if you can't make things as fair as possible, as far as remote versus in person, that's not a reason not to have remote workers. But what have you, as far as your department, how has it sort of addressed you do need someone on site for certain sorts of things? We all know there's procedures that need to be done. We know there's contrast reactions. There are certain things that physicians have to be on site for, and so that there is no flexibility to that. So how have you addressed those sorts of inequities?
Yeah, no question. So I mean, we can't cover contrast reactions. We can't go run to the scanner. But I think remote radiologists in our department have maintained a really close connection with the on-site colleagues, with the technologists, with the trainees. And so we developed a remote division about a year ago. And within 1 year, we've expanded that division to 6 fully remote radiologists. They're all subspecialty fellowship trained radiologists. And we want our radiologists to be part of the academic mission. They have academic appointments, just like other faculty. They have expectations to do clinical work as well as teaching and research. And part of that involves workstation teaching too. And so they are connected with the teams on site. And certainly these video conferencing platforms have allowed people to connect. It's not always the easiest way to do teaching, and it requires a lot of effort from both the teacher and the trainee. But in my experience, I've been able to have successful educational encounters with trainees, and it's been a productive and useful experience. So it's not without challenges, but I think it can be done, and I think we've done it successfully at our institution.
Excellent. Yeah, and I'm glad you're talking about educational, because that was one of our other big components, which I think is potentially the very most important, is the impact on the trainees. And I agree that the remote, radiologists, even when I work remote and work with a trainee, maybe it's sometimes even better. You can have some more time to to teach and carve that out. But I also have had the experience coming in, when you're working with trainees and realizing how little they really know about how to navigate PACS, which is some things that need to be able to see the mouse movements and need to be able to see, the different sorts of, just there is some specific, learning about PACS, and especially if you have, trainees rotating every single month, it's useful, I have found, for them to physically see a radiologist and how they, are using the PACS, since it might be a very different one from them. Also, just as far as phone calls and witnessing and hearing how the phone calls are handled by a radiologist, as opposed to, just leaving the trainee in the room without, listening to that. We found the trainees have very much there, at least ours, are agreeing that it's the teaching can be, certainly as good or better remote, but there's a lot lacking as far as the overall learning of how to be a radiologist if someone's not physically there, a lot of the time. I think that's something we still have to work out.
No question. I mean, I think a lot of us learned how to be radiologists by sitting down at a view box with an attending. And that's, you learn side by side. That's the traditional way that many radiologists learn. And I think a lot of the approaches to this kind of synchronous traditional radiology readout can be applied in a virtual setting. There's some components that are required to make it successful. But I think, if you get engagement from the trainee and you can figure out ways to make it an interactive session and make it purposeful, I think, it can be a productive thing, but it's not without its challenges. I should just say that education wasn't really one of the pieces that we talked on in our piece.
Sure.
But I think it is something that is an important thing to consider. If you're implementing a remote division or remote radiologist, how are they going to be interfacing with your trainees is an important thing to consider. Absolutely. The one other big thing that we just included in our article with respect to remote is that it's been able to allow us to expand our staffing and increase staffing in areas that we've been struggling to fill positions in the past. And so remote radiologists really expands the pool of available individuals to potentially recruit, and also allows you to find people who are subspecialty trained, who are experts, and they can provide coverage to areas in the community or more rural sites that may be harder to find a subspecialty radiologist to actually physically be there. But you can still provide the same quality reads in a remote fashion. And so those are some of the benefits that we thought remote radiology can provide.
I agree. There are many benefits to remote radiology, and I think that it's good to be having this discussion because remote radiology is here to stay. It's not a matter of yes or no. It's a matter of how are we going to make remote radiology work, and it has been here to stay. Like we've had teleradiology for decades now, but it has really changed where it's very expanded. It's here to stay, and now the question is like, how do we work it in for long term to make sure that our trainees are well taken care of, our professional staff, including the technologists, the administration who's physically present, the nurses, making sure that they are still very connected with the entire department, if more and more of the physicians are remote. And then just the social well-being of the physicians. That's another thing that we just have to figure out how we're going to work that in as we take care of these, and take advantage of these substantial benefits from the flexibility and other factors that remote work provides.
Yeah, I agree. I mean, I think remote is here to stay. It's not going to replace all of the on-site radiologists. It's really going to be a supplement. I think it should be something where we can coexist and really augment each other, make each other work more effectively to accomplish whatever goals we have during the day. And so I think figuring out a way to have remote and on-site work kind of harmoniously like this is hopefully that can be the way forward.
Yeah. Well, I've really enjoyed having this conversation. I don't know if there's anything more.
No, thank you.
Yeah.
Thanks so much.
I mean, I think that for and if for people hopefully watching this video, I'm sure that both Dan and I would be very happy to communicate more about this topic. I think it's a great long-term topic that we're going to be within radiology doing a lot more studying on and have a lot more discussion about.
Sounds great. Yeah, thank you so much. Open to any questions if people want to reach out. Thank you.